Hi, everybody. My name is Zara Dureno. I am an occupational therapist and I work at the Surrey Neuroplasticity Clinic, and I also have my own company as well. And I am a huge nerd for neuroscience and understanding neuroinflammation, which we're going to be talking about today, which is inflammation in the nervous system. Is really helpful for helping us understand a lot of different conditions, as you'll find out. So today we're going to talk about what neuroinflammation is and how we can treat it, what we can do in terms of self-management strategies, and also things that you can chat with about your doctor. So yeah, let's just jump right into it. What is neuroinflammation? So neuroinflammation is the activation of the brain's immune system, right? So if you think about it, anytime that you get injured, you have a bit of inflammation. So for example, if I stub my toe might get a bit red and it might get swollen. And that's inflammation. It's going to the area, it's trying to heal the area. And in a small period of time, inflammation is actually quite a good thing, right? When we have inflammation, it means that we are healing that area. But if we have inflammation for a long period of time, it can lead to a whole host of the symptoms. So if we have it in the body, it can lead to things like chronic pain and different inflammatory diseases. And then when we have it in the nervous system and in the brain, it can lead to a whole bunch of different things like fatigue and difficulty with our cognition. So things like memory and attention, and a bunch of our other cognitive functions can really take a hit because of the inflammation. So basically, we have these tiny little cells in the brain called glial cells, and they make up a huge portion of our brain. And what they do, their job is to go around clean things up. But what happens with inflammation, if it's going on for a long time, is that the glial cells in our brain actually become overactive and they do too much. So they're producing too many inflammatory chemicals, and that makes it so that there's this excess of inflammation in the brain. There's also some structural changes that happen to the glial cells themselves, where they basically get a little sleepier and they're eating too much. So they're kind of stationary and just eating whatever instead of eating the debris. It sounds like a horror story or something, but it's not as terrible as long as we know what it is and then we know how to treat it, right? The issue with neuroinflammation is that it's quite new in a lot of research. So a lot of doctors don't know about it. A lot of people aren't really informed on the practices and the things to do and how to treat it. So it's important to start to understand this information and to know how to treat it so that we can make sure that it doesn't cause further damage. So what are some of the things that can cause inflammation? So TBI, which is traumatic brain injury, and that can be anything from a concussion to a severe traumatic brain injury. So a concussion just means that the traumatic brain injury is a little bit more mild and there usually isn't structural damage. When we see more structural damage, it's more of a severe traumatic brain injury. And that means that there might be like, a chunk of the head that was impacted fully or something like that. Whereas a concussion is really just the brain bouncing back and forth within the skull, and it's more of a functional injury, meaning that it impacts the function of the brain. But any sort of traumatic brain injury from a concussion to a severe traumatic brain injury can cause this inflammation. And there's been some very interesting research in the last couple of years that highlights that inflammation after a concussion might be part of the reason why some people have post-concussion syndrome, where they continue to have symptoms even long after their concussion, because the brain will heal, but if there's a lot of inflammation, then that can cause a whole bunch of symptoms as well. So stroke, as you can imagine, is also a traumatic event for the brain, and that can lead to prolonged inflammation afterwards. Another very interesting thing that can cause it is extremely high stress or trauma. So if someone experiences a traumatic event, which usually involves threat to your life or someone's life in your vicinity, or you've experienced high stressful situations for a long period of time, the systems in our brain that create inflammation can end up just creating a whole bunch of inflammation. And that can end up causing this sort of chronic inflammation in the brain. And as you can imagine, our brain and our body are connected. So if we have inflammation in our brain, sometimes it ends up being inflammation in the body, or if we have inflammation in the body from things like our diet and things like that, then that can cause inflammation in the brain. So that brings us to the gut permeability issues. So when we have IBS, and of course, IBS is connected to trauma, like psychological trauma as well. So you can see how these things all start to kind of fold in on each other. And this is why it's really important to see healthcare providers who have an idea and understand sort of how everything is pieced together and aren't just looking at your gut separately from your brain. It's important that we're kind of considering all the parts of the puzzle together. One thing I want to mention before we continue on with the education is just that if you have any questions, feel free to type them in the chat. I'm not going to answer them throughout, but I will answer. We have half an hour at the end for answering questions. So just type them along as you think of them, and I'll answer them at the end. So another thing that can cause inflammation is MS, Parkinson's, and Alzheimer's. And we find that when we reduce the inflammation, some of the symptoms of that can be reduced. They are progressive diseases, so or disorders, so they are going to progress over time, and it's going to continue to get worse, but they can be managed by managing some of the inflammation. And sometimes people get a relief of some of the symptoms, which can be, really life-changing for a lot of people. It doesn't mean it's going to cure it or that it's going to go away, but it can provide some help. Environmental pollutants. So I see a couple of my clients have had toxic mold exposure, and that caused inflammation in their bodies, in their brains, and then that led to a bunch of different issues with fatigue and concentration and things like that. Uncontrolled, unmanaged diabetes. If somebody is celiac, but they don't know it, but they're eating a lot of gluten, that can cause inflammation in their gut, which then can cause the inflammation in their brain. Systemic inflammation. So, if there's been like a lot of injuries, a lot of accidents, or viruses is a really common thing. There's an interesting connection between chronic fatigue syndrome and the Epstein-Barr virus. Some people think that they're connected, or, long COVID can sort of look like chronic fatigue. So there are these connections between viruses and chronic fatigue. And some scientists think that the underlying sort of connection there is the inflammation is sort of contributing. The virus has caused that inflammation, and then the inflammation is continuing on the original havoc that the virus wreaked. So again, this is one perspective, and it's not the whole picture. And I'm not, an expert in all of these different disorders, so I couldn't tell you the whole picture for every single one. But the perspective of neuroinflammation is an interesting one, and it's an interesting part of the puzzle for a lot of these things. So what are the symptoms, right? How do we know that we have inflammation, neuroinflammation? So some of the subtle symptoms, if we have subtle inflammation, are brain fog, reduced brain endurance. We might feel really slow cognitively, brain fatigue after exposure to specific pollutants, chemicals, and scents, brain fatigue after specific foods. That can be in the subtle range. In the moderate range, depression, inability to concentrate, sleepiness, increased need for sleep, lethargy, malaise, being the inability to be physically active, the lack of motivation, irritability, anxiety, memory loss, sensitization to pain, and sensitivity to noises and lights. So you can see how the moderate and the subtle really sound like a lot of conditions, right? Like it sounds kind of like chronic fatigue, and it sounds kind of like post-concussion syndrome, and it can even sound like fibromyalgia in some cases. So yeah, it's interesting how these symptoms all kind of conglomerate together, and it becomes confusing from a diagnostic perspective, right? Like doctors trying to figure out what's going on, it becomes confusing to figure it out. But there are some, I've been reading since I took the course in neuroinflammation, I've been reading a lot about it, and reading about the connection between anxiety and ADHD, depression, fatigue, and neuroinflammation is very strong. And there's some people who really assert that things like depression and anxiety are largely caused by neuroinflammation, which can be caused by stress and trauma, right? So you can see how it's all connected. But when we treat it, anxiety and depression can be reduced. So I've had a lot of clients who They have uncontrolled anxiety. And when we look at the inflammation piece of things, their anxiety can be significantly reduced. So it's just another thing to think about. The severe inflammation, so this is very rare. So this is when it gets to the point of it being like fully blown, like meningitis type inflammation. So like tremors, difficulty speaking, seizures. Some people might be in a coma, personality and behavior changes, and severe cognitive decline. So this would be like, you would be in the ER, you would be in the hospital. It would be extremely severe. It's rare that it gets to that point, but like some people do have like a really severe inflammation, especially of like the cortex of their brain, and that can cause these intense symptoms. The inflammation, when it's more subtle or moderate, what we're talking about is the glial cells. We're less talking about like the cortex inflammation, because when the cortex gets inflamed, you're kind of infringing on the space between the brain and the skull, and that creates some like pretty bad symptoms. So this is a little bit different from that kind of inflammation and what you might have heard about that. So like we talked about, the secondary effects, so it can be caused by some of these things, but some of these things also end up being the effect of inflammation. It becomes a chicken and egg situation. But again, that depression, anxiety, chronic fatigue, fibromyalgia, chronic pain, cognitive difficulties, Alzheimer's, Parkinson's can be secondary effects, or they can cause more of it. So it just becomes a bit of a cycle. So self-management techniques, we're going to go through all of these today. So diet, supplements, medication, exercise, vagal stimulation, air filters, sleep, heat and cold, and proper breathing. So if you saw the other two presentations that I did on somatic therapies and nervous system regulation, then you're already ahead of the game. You're already reducing your neuroinflammation. So congratulations, you're doing a great job. But we're going to talk about some other things that can impact it as well. I am an occupational therapist. When I'm providing advice like this, it's more under the hat of a neuro coach because it's a bit outside of my scope. So this is really just more of my coaching hat. So please just know that when we're talking about diet, we're talking about supplements and medication, especially make sure that you discuss this with your doctor. I know that a lot of you probably have, complex cases and you might be on a lot of different kinds of medication. And so please don't go and start something just because you watched this presentation. Please talk to your doctor or a pharmacist about interactions first and make sure that you're doing the right thing for your body, because it's not a one size fits all. And I want to make sure that, any medical advice given is not just taken. Just definitely talk to a medical professional first, because that's not the relationship you and I have, because I don't know your personal case. And I'm not allowed to prescribe supplements or medication anyways. So talk to your doctor. So let's talk about diet first. Why does it matter? Why should we care about our diet? If there is one thing that is going to reduce inflammation the most, it is diet. And I know that sucks to think about because, especially if you're not feeling well, and maybe eating is like one of the things that's like nice to do. We don't want to think about changing our diet, and changing our diet is hard, but it's really important because inflammation from the brain goes down the vagus nerve into the gut. So both our brain and our gut have neurons, so like the nerve cells in our brain, and microglia. So when we have a lot of inflammation in the brain, we can have a lot of inflammation in the gut and vice versa. So when our diet isn't good and we're not supporting our diet, then we can cause more inflammation in the brain. But when we do support our diet, we can reduce the inflammation. Our gut messenger pathways directly affect our body's ability to regulate our inflammation. So we're going to get into how that works and why that works, but just know that like if you're going to do one thing, diet is going to be probably the biggest thing. Diet and nervous system regulation, soothing the nervous system are going to be the two things that are going to be heavy hitters for inflammation. It's just hard. It's hard to implement this. So diet, a variety of fiber, I can't stress that enough. If you can get as much different kinds of vegetables and fruit and nuts and grains and seeds and fibrous things, you will be doing really well, because basically what happens is that different fibers create different short chain fatty acids, and those short chain fatty acids travel up the vagus nerve into the brain, and they produce things like serotonin and dopamine, and they help to mitigate inflammation. So you might have heard that, like 80-90% of serotonin is produced in the gut. It is, but it can't cross the blood-brain barrier. So we need the short chain fatty acids to cross the blood-brain barrier to get into the brain to make those happy chemicals. So serotonin, dopamine, like norepinephrine, all these different hormones and chemicals that we need in our brain, a lot of them are helped, the production is helped by these short chain fatty acids. So what this means is that, like, every meal, if you can include in that meal 5 or 6 different kinds of fiber, and that might sound like a lot, but if you think about it, like an oatmeal could have the oats, it could have some hemp seeds, it could have chia seeds, it could have nuts, fruit, you know what I mean? You could make a smoothie that has 6 different kinds of fruit and veggies in it. I know it's tricky when we think about, finances and our ability to do this, but you can get creative with it. There are lots of, cheap fiber options out there as well. But yeah, there are some interesting anecdotes that I've heard of people just having, like, one guy got really serious about it. He had like 100 types of fiber every day, and the results that he saw within a few weeks of doing that was pretty remarkable. He was somebody who had Parkinson's, and he really was able to mitigate a lot of his symptoms just by increasing fiber. So that is very, very important. Now, of course, if you're having fiber, we need lots of water. What's recommended is 10 cups in the first 10 hours. I know we've all heard the whole 8-cup thing, but this is sort of like the newer thing to do. So every hour when you first wake up, 10 cups for the first 10 hours. Of course, listen to your body. If that feels like too much, that's fine. And if you're getting a lot less exercise than the average person, you might not need 10 cups, right? So if your energy envelope is lower, then you might need less water. Also try for every cup of coffee or caffeine, tea, pop, whatever it is that has caffeine in it that you drink, that you replace that with a cup of water, because you're dehydrating yourself with the caffeine. So water is going to be really important, especially for regulating blood sugar, and blood sugar directly impacts inflammation, like we talked about with the diabetes. Polyphenols are really good for reducing our inflammation. So these are plant chemicals. They're found in things like berries and dark chocolate. So that's a win for people who like chocolate. I love dark chocolate, so this is like really good news for me. Tea, especially green tea, apples, citrus, onions, soybeans, coffee. There's a lot of contention in the scientific community about coffee and whether it's good for you or bad for you, or good for you or bad for you. I think that as long as you're staying within, 100 to 150 milligrams of caffeine early in the day. So caffeine has a long half-life. So if you drink caffeine at 10 a.m., there's still going to be caffeine in your system at 10 p.m. So if you're drinking caffeine at 2 p.m., there's going to be caffeine in your system at 2 a.m. So you want to make sure that you're drinking it early in the day, depending on when you want to go to sleep at night and depending on your schedule. But yeah, as long as you keep it to a relatively small amount of milligrams of caffeine and early in the day, you should be good. The problem with coffee comes when we drink more than basically a cup, then that creates a whole bunch of anxiety that can further the inflammation, right? So we just want to have it in moderation, which I know is hard if it's a habit to sip it all day. Unsaturated fats. So, things that are unsaturated fats are found in a lot of nuts and seeds and plant oils. Those can be really good for helping to reduce inflammation. Things to avoid. So if we really suspect, again, I can't diagnose anything, but if I'm talking to a client, we really think that neuroinflammation might be part of a picture, or their doctor has said that, they think it might be part of the picture, wheat and milk are the most inflammatory foods that we can eat. Sometimes it's the wheat itself. Sometimes it is the pesticides that are used on the wheat. Just because of the way it's processed, it's like a lot more common for people to like actually ingest them. And so, yeah, 15 to 17% of people, this was with traumatic brain injuries, but 15 to 17% of people studied had really significant increases in C-reactive protein after having wheat or milk. So that C-reactive protein is an example of a blood biomarker that shows you if you have inflammation. And one thing I don't know, which Dr. Arsenault might be able to comment on at some point, is if we can test for neuroinflammation with like blood work or things like that. I don't have an answer to that question, but maybe he does.
You can, but it's not available clinically. It's available in research.
So it's a bit new. So C-reactive protein doesn't really tell us that much about.
No, patients with chronic fatigue syndrome almost always have a normal CRP. And if they don't, I usually suggest they get investigated for something else.
Okay, but to test for neuroinflammation would be a different blood test that's not available medically.
No, exactly.
Okay, great. Yeah, I get that question a lot, so it's good to have that cleared up. I've tried to look it up, but I could never get a clear answer. So yeah, wheat and milk are very inflammatory. So sometimes if a client is willing to do it, we suggest just cutting them out for a little while. And usually we need at least like a month for this to be fully kind of gone from the body. So trialing it for about a month and then maybe introducing a little bit of milk back, maybe introducing a little bit of wheat back and seeing if your symptoms change or if they improve, that can be something to consider. It is a bit of an extreme diet, but I mean, there's a lot of gluten-free options. So with wheat specifically, we're talking about the gluten. There's a lot of gluten-free options, and with milk, there's a lot of dairy-free options. So thankfully, we live in a time where it's a lot easier to do, but you know, it's still not the easiest thing, especially if you're on a budget. But with this, if you're going to try this, again, talk to your doctor or something if it's a good idea for you to try, or maybe a nutritionist. And like, it's really hard because they're in everything, right? Milk is in everything. Like, I am lactose intolerant, so I can't have milk. And the other day I had a bag, I was eating some Miss Vicky's chips, and I didn't realize that the salt and vinegar had milk dusted on them, because I just didn't think that a chip like salt and vinegar would have milk on it, right? So just read ingredient lists, because even things that you really don't suspect, sometimes they sneak milk in there, and sometimes there's wheat in there for no apparent reason. So just check if you're going to do that. Sugar and sweeteners, especially like things like aspartame, really not great for the brain. I know that a lot of people like to drink pop to help with energy and stuff like that, but if you can try and get off of it, that would be really, really good. Because like, if it's not Diet Coke, let's say there's like a massive amount of sugar in there, and if it is, then there's aspartame, right? So some of the sweeteners that are a bit more safe are like stevia or xylitol, things like that. But just raw sugar, like white sugar, even cane sugar, is highly inflammatory, and fake sugar is as well, because it messes with our blood sugar levels, and that can cause a lot of inflammation. So, and there's just like a lot of cognitive issues with fake sugar as well. So just consider that. Processed food. So the more like far away something is from the original, what it looks like when you take it from the plant or take it from the animal, then the worse it's going to be, because it has a bunch of nitrites and you know, all these different like chemicals to help preserve it and help make it taste better and all this stuff, and just different fillers, and those can interact with the body, and it's just not going to be a healthy way to feed the gut. We already talked about the too much caffeine thing. Saturated fats, so you know, I mentioned the bag of chips, you know, you got to live your life, but reducing things like anything that's fried in oil, or yeah, you can pretty much like think about all the things like a Twinkie or a cookie or a cake, or, you know, the things that have a lot of fat in them, are, especially saturated fats, are going to be worse for inflammation. Alcohol is a big one. If people are not already off the alcohol, we usually try and make that happen, just because it is highly inflammatory and there's often a lot of sugar involved. And then a lot of people ask about fasting, like intermittent fasting. From what I can tell, it doesn't seem to be like the greatest idea unless you're in ketosis. So unless you're on a keto diet, which can be good for inflammation, it can be a good diet to try. Unless you're on a keto diet, then I wouldn't recommend fasting. But again, like with a lot of things with diet, literature is conflicting, right? Everyone has a different opinion on what's good and what's not good. So listen to your body. Your body will tell you what is good and what isn't, because it'll tell you how you feel after. So sometimes it just takes a little bit of experimentation and really listening to your body and what you need. Omega oils are a big part of inflammation. For people who have migraines, there was like an interesting study that came out about just changing your diet to have more omega-3 and less omega-6, and it really significantly reduced migraines for a lot of people. So that's an interesting study to consider. So basically in the North American diet, we usually have a lot of omega-6s and not enough omega-3s, because omega-6s like sunflower, corn, soybean oil, processed foods, corn and soy-fed meat, margarine, mayonnaise, deep fried foods, these are everywhere, right? If you look at the packages of a bunch of processed food like cereal and even things that you think might be healthy for you, like a wrap, let's say, oftentimes they have these oils that are really high in omega-6s in them. So yeah, that's another reason why we want to stay away from processed foods like, you know, cereals and wraps and you know, white bread and things like that, because of those high omega-6s. Increasing omega-3s, omega-3s can be a great supplement to take depending on what's going on with your heart. So again, chat with your doctor about the supplements. But we can also increase omega-3s with flax, hemp, and chia seed, with omega-3 enriched eggs, with cold water fatty fish, with spinach, and again, with the supplements. So thinking about increasing the omega-3s and decreasing the omega-6s can be really good for reducing inflammation, and that can reduce pain and migraines and mood disturbances and things like that. So yeah, just thinking about that and how you might be able to adjust your diet in that way. Probiotics and prebiotics. So we've probably heard about probiotics. There's some interesting kind of thought about probiotics where sometimes for some people, probiotics cause more brain fog, depending on the strain of the bacteria that's in the probiotic. But for some people, it does cause more brain fog. Prebiotics are less likely to do that. But yeah, sometimes you have to experiment with a couple different probiotics and see which one doesn't cause brain fog for you. If you look up like probiotics and brain fog, there's probably going to be listed like the ones that are most likely to cause it. So if you are going to take like a probiotic supplement, then you might want to check that out first, because if you already have brain fog, you don't want to increase it. But when we get it from food rather than from a supplement, it's going to be absorbed better anyways. So for most of these things, I recommend trying to get them from food as much as possible and then supplement on the side. Some probiotic foods that are out there, you could, and these are plant-based because again, we want to avoid milk, right? So you can get coconut kefir, tempeh, miso, non-dairy yogurt. A lot of them will have probiotics in them. Pickled veggies, kimchi, sauerkraut, and natto. These can all be things that have probiotics in them. Prebiotics, these, again, asparagus, garlic, himica, bananas, chicory root. Chicory root is a really nice coffee replacement. So if you're used to drinking coffee all day, getting yourself some chicory root, just make sure that if you're avoiding wheat, that the substitute that you get doesn't have chicory root and barley, because then you're having wheat. So yeah, the chicory root, if you just look for it if you Google like chicory root coffee replacement, it tastes pretty good in my opinion. And then you're also getting the prebiotics, which is nice. The Jerusalem artichoke, onions and leeks, and leafy greens and dandelion greens. Of course, we all know that dark leafy greens are good for us, but this is part of the reason why, because of the prebiotics. So the good bacteria, we're supporting a healthy gut biome. And when we have a healthy gut biome, then we can also support healthy brain function. So this is why that's important. So let's get into supplements. So we talked about polyphenols before. So you can get polyphenols from having things like green tea and vegetables and things like that. But for a more concentrated version of polyphenols, resveratrol is probably the best one. It's very expensive though. So, but resveratrol is very good. Curcumin's also good. It's way cheaper. Curcumin is turmeric. You can get turmeric by putting it in your food, but you'll never get the amounts that you need from actually concentrating it into a pill. So you can think about resveratrol or curcumin. With curcumin though, just take a little mental note. If you're going to take turmeric, it needs to be absorbed with a fat. So usually coconut oil is a good idea. And black pepper. Those two things help it absorb. Without those two things, it doesn't fully absorb into the body, and then you'll just pee it out. So if you're going to take curcumin, you can look for ones that have that in it, or you can add it yourself. So just like having a meal with it, with black pepper on the meal, could be helpful. Apigenin, that's from celery, but again, you can get it concentrated into a pill. And catechins, so this is in green tea. If you're a coffee drinker, you might want to think about every other day replacing it with green tea just for the health benefits of green tea. Essential fatty acids, so omega-3s, 1,000 milligrams of DHA and EPA per day. This definitely helps with inflammation. It protects your neurons from any damage, and it improves your neuron membrane functioning. So some people with blood pressure difficulties can't take omega-3s, so just double check with your doctor or pharmacist about all of these supplements again, but specifically with the omega-3, definitely make sure to check before you take them. And you also want to make sure it doesn't say omega-3 and 6, right? Because we're trying to reduce 6. We definitely get enough 6 in our diet, so don't worry about taking a supplement that's 3 and 6. Try to make sure that your supplement is only 3. Magnesium taurate or bisglycinate. Magnesium citrate is usually the one that people take. It's like the most common one that's at the grocery store. I find a lot of people have stomach upset with the citrate, and it just doesn't absorb as well, and it doesn't cross into the brain as easily. So magnesium taurate, which is a little bit more expensive, and bisglycinate, which usually comes in like a powder form, those actually get into the brain, and it has a kind of a double effect where it can reduce the amount of inflammation, but also it can help with anxiety. A lot of people report that when they take magnesium, their anxiety goes down. Magnesium is a very key factor in the maintenance of migraines. So taking magnesium bisglycinate can reduce migraines and pain too, and sleep. So there's a lot of great things that magnesium is good for. I usually recommend people take it at night, unless you have a lot of like really high anxiety, then you might want to take it during the day because it can settle that anxiety down. It's kind of like, for example, if you take an Ativan when you're not anxious, it's just going to knock you out. But if you take an Ativan when you are anxious, it's just going to make you have a regular day, right? So just depending on the amount of anxiety, something that's relaxing the brain will impact you differently. NAC. So I used to put glutathione on here, but from what I can tell, unless it's liposomal glutathione, it's not really absorbed super well. If you're just taking like a glutathione pill, it might not absorb properly. So NAC is like it's a precursor to glutathione, and I find that it, like, just from what I looked at, it seems like it works a little bit better. And that can help to reduce blood-brain barrier permeability, so that, when we have a lot of inflammation, there's more permeability, meaning more things can get into the brain. So this helps to reduce that permeability. And a lot of people have really good effects with liposomal glutathione or NAC. Again, it's another one I would take at night. If you are a weed smoker, just know that THC is inflammatory, so it can make things worse. CBD, however, is anti-inflammatory. So if you want to switch your strain to one that's higher in CBD, that can be more beneficial, or you can just take straight up CBD oil, and that's anti-inflammatory, and it helps a lot of people with pain. It helps people sleep as well. And ginkgo biloba is another good one for cognitive function, especially. All right, so medication. So if you're a patient of Dr. Arsenault's and you've seen him already and not on the waiting list, it's likely that you might be on LDN already, low-dose naltrexone. One of the mechanisms of action, there are many mechanisms of action of low-dose naltrexone, but one of them is that it reduces inflammation. So yeah, it's a really good one for reducing inflammation. Because of that, it can help with cognition and anxiety. And the only thing that I find people report is that sometimes they have really weird nightmares with naltrexone, but it usually goes away within a little while. Because it's such a low dose for people who have like really sensitive immune systems and tend to react to other drugs, I find that this is one of the drugs that works better. Of course, you need to chat with a doctor about this. If you haven't seen Dr. Arsenault yet, you can talk to your family doctor about LDN, but just bring an info sheet. So if you Google low-dose naltrexone info sheet, there's a one-page document that just outlines some of the major research with low-dose naltrexone and talks about its implications, and also talks about like the scheduling and the dosage and things like that. A lot of doctors just aren't familiar with what it is or how it works. A lot of doctors think that naltrexone, because naltrexone at a high dose is used for helping people to come off of opioids. So a lot of doctors just kind of have that association in their mind that naltrexone is for opioid abuse, or people who are struggling with using opioids. So yeah, bringing that info sheet can help you to advocate for yourself. And yeah, it can make a big difference. I've also seen some things about progesterone reducing inflammation, but obviously hormones are a very unique balance in the body and need to be everything needs to be considered. So your doctor can go over this with you and decide if one of these is a good option for you. So exercise. Now this becomes challenging, right? Because if we have inflammation, we probably have some kind of exercise intolerance, right? Because too much exercise can cause basically more inflammation. So what we want to do is exercise, but not too much. So this is very highly individual, and you want to find the just right challenge. So the part of exercise that works for you personally. And the more intense exercise is, there's going to be more of an opioid release, and there's going to be more of changes in the brain. But we want to make sure that we're not exercising to the point where we're, causing that post-exertional malaise or causing exhaustion or crashing if you have post-concussion syndrome or something like that. Because that short-term oxidative stress is really hard for a lot of people. So sometimes we don't even use this approach first at all because it's hard for a lot of people. But you definitely don't want to just be inactive. It's important to move around within your tolerance as much as you can. So it's good to think about exercising within your tolerance. And also when you're exercising, it's good to think about the other inputs into your brain. So are you exercising in a loud room with people like kids screaming around, or are you in a quiet room where there isn't a lot of visual or audio distraction? Because it's going to be different in terms of how much cognitive load your brain is experiencing. So think about that with exercise as well, not just like the actual exercise itself. But if you feel like you can't do 10 minutes of one activity, do 2, do 1, do like a little bit of a movement. Anything that's like actually getting your blood flowing will be good, but you just want to, again, work within your own tolerances and maybe talk to a therapist about how to do that, like a kinesiologist, physio, or an occupational therapist. So vagal stimulation and stress reduction. So basically when we use our vagus nerve, and we soothe our nervous system. So if you came to the nervous system regulation talk, you'll know that the vagus nerve is like a brake on the nervous system. It helps us to calm down. It helps us to feel soothed. if we strengthen that nerve, we're reducing our inflammation. So because we talked before about how stress and trauma can cause more inflammation, the inverse is true. Relaxation, peace, love, gratitude, positive affect can reduce inflammation. So we talked about these in the nervous system regulation PowerPoint. So I'm not going to go into detail with all these. You can go back and watch the YouTube of the nervous system regulation to get an explanation of each one of these, because it would take way longer than the time that we have to actually do this. But just to highlight a few of them, the physiological sigh is really great for soothing and calming the nervous system. It's an inhale and then a sip of air at the top and then a long exhale. So if you want to try it with me right now, we can. Great. So I find it to be very soothing. And yeah, you can kind of play around with that. If you do it a few times in a row, it can be more beneficial. Another one that I really, really like is to visualize something comforting. So just even if you just take a minute closing your eyes and just imagining something comforting, it could be, you know, if you have a spiritual belief, it could be maybe your God or some kind of spirit guide. Or if you have, you know, maybe a comforting family member or pet or place in nature that you really like to go, if you really visualize that, it can help to soothe the system, calm you down, help you to feel peaceful, and really focusing on your breath as well. So changing, making sure that you're slowing your breath rate down and breathing from your belly. Use of the eyes is another one that's really good. So being aware of your peripheral vision can help to soothe the nervous system. Also, if you close your eyes and kind of massage around the orbital bone, that can really soothe the system, because you're basically telling it that there are no threats in the environment. So we want to work with soothing the nervous system as much as possible. Air filters. So, I mean, we've all seen the news, right? There's a lot of fires happening right now. I live in Nelson, BC. I'm looking out my window and it's a lot of smoke. So air filters can be helpful because things like smoke especially can make inflammation worse. And dust, pollen, mold, bacteria, these kinds of things can make it worse. So a HEPA air filter is sometimes recommended. It's a high efficiency particulate air filter. And they can remove all of that from the house. So, you know, making the air cleaner and therefore reducing the risk of furthering any inflammation. Oral hygiene is also really, really important. So, yeah, inflammation of the gums has a direct link into the brain. So when our gums are inflamed, it can cause a lot more inflammation in the brain. So brushing your teeth and flossing daily, twice daily, that can reduce your inflammation and save you a lot on dental bills. And I know that when you're, you know, really, really tired from some kind of chronic condition, that it might seem like a lot of energy, but it is something that's really important. And if you're going to, you know, make sure that you save a little bit of your energy envelope for that, for brushing your teeth and flossing, because when we let that go, it can really increase inflammation quite a bit. So sleep hygiene. If we get better sleep, then our inflammation will reduce. A lot of people, you know, especially now, have really bad sleep hygiene because we're so connected to our devices, and being on our phones within an hour before bed, probably even 2 hours, to be honest, is really detrimental for our sleep, because it blocks the production of melatonin. And I've had people say, well, I have a blue light blocker glasses, or I turn down the light on my phone, or I use different programs to make it less effective. It doesn't matter. I mean, it probably helps a little bit, but a screen and light in general is very unnatural for us to have. If you think about it, like, we didn't, up until a couple hundred years ago, didn't have these like or well, not even that long ago, like up until not that long ago, we didn't have screens. We didn't have these bright screens that were in our faces. So it's quite unnatural for our evolutionarily, how our bodies have developed evolutionarily, and having light, even overhead lights. So even just like, you know, the lights on your ceiling on within an hour before bed can really reduce your ability to produce melatonin and to go to sleep. So being really strict with yourself that an hour, if not 2 hours before bed, you're not going to go on any screens, including a TV, computer, and phone, then you can really help to reset your system. Having a sleep ritual, so doing the same thing. If you think about it, kids often have sleep rituals, like they get a book read to them or whatever, and that helps them to fall asleep. So if you do the same thing, that can help you to get better sleep as well. So some kind of sleep ritual, it could be journaling, it could be meditation, it could be really gentle stretching, it could be, you know, having question prompts with your partner or a friend. Anything that doesn't involve a screen, you're good to go. That's your sleep ritual. Routine, so trying to wake up and go to bed at the same time. It can be hard when you're not at work, right? To stay in a routine. So trying to keep some sort of routine can help your body to prepare for sleep. Making sure that you only use the bed for sleeping, sex, or meditation. If we're using the bed for going on our phones and watching movies and reading, our brain is going to start to associate the bed with activity. So just making sure that we're only kind of using the bed for those things and not for, you know, active thinking time. Limit napping. This is hard for people, especially people with chronic fatigue. But if we're napping after 3 p.m., we're kind of setting ourselves up to not have the best sleep that night. This, within the chronic fatigue realm, there can definitely be some exceptions for napping, but this is sort of just a general rule, 30 minutes before 3 p.m. and in the bed. If you are going to nap, make sure you're napping in your bed and not like on the couch or something, because then, again, you're starting to associate your bed with sleep. Cool, dark, comfortable. So dark means you can't see your hands in front of your face. So if that's not possible in your room, then maybe getting an eye mask. And cool means 18 degrees. That is like the optimal temperature for sleeping. So if you can't get that, maybe you don't have an AC, you can get kind of like it's like half between an AC and a fan. It's like a little fan that you load ice into. Like if you don't have enough money for an AC, there's a little fan, you just like load ice into it and then it blows cool air on you. So something like that could be helpful. Obviously avoiding sugar, caffeine, alcohol, difficult exercise, exposure to cold, and big meals near bedtime because they all wake you up. Regular exercise, as much as you can within your envelope, and exposure to sunlight. So this is really important. Get sunlight within the first 15 to 20 minutes of waking. Like literally go outside, stand on your porch or wherever you can stand that's outside, and absorb sunlight through your eyeballs, because that will help set you up for the rest of the day. Again, of course, you're going to have to think about this within your energy envelope and within planning your day. But if you can have your breakfast on the porch, do it, because that natural sunlight is going to help regulate your cortisol and it's going to help regulate your other hormones throughout the day. If you're a type of person that sets multiple alarms, try not to, because every time we wake up, we're pulling ourselves out of a sleep cycle. And if you go back in, you're going back into stage 1 and you're not completing that sleep cycle before the snooze goes off. So if you set multiple alarms, you're basically just like giving yourself this super disrupted sleep cycle over and over again. And you're really messing with the cortisol for the rest of the day. Having cold in the morning. So I recommend a cold shower in the morning. If you must take a hot shower, then maybe finish it with cold. And if you hate the idea of taking a cold shower at all, then take a hot shower at night, not in the morning. Because if you take a hot shower in the morning, it's going to make you more tired. And if you're not sleeping after 20 minutes or you wake up in the middle of the night, you can do a meditation. So don't turn on your TV and start watching a movie or start texting your friends or whatever, but just start with a meditation and see if you can keep your eyes closed, because you'll still get some rest from that. Okay, we're kind of nearing the end here. Let's just talk about breathing. So when we're regulating the nervous system, there's three things that we really want to focus on. And I challenge you over the next 3 days to pay attention to this as much as possible. Because if you are living in a dysregulated nervous system, I guarantee that you're probably not breathing as deep as you need to. So slow breaths, nose breaths, and belly breaths are going to be really important. So if you focus on anything in the next 3 days, focus on this. Slow your breathing down. So consciously, every time you can think about it, literally every time it comes up in your mind, slow that breath down. Breathe from the nose instead of the mouth. So the exhale doesn't matter as much, but the inhale does, because on the inhale, we're filtering air. We're filtering things. There's a lot more filtering structures in the nose, and nose breathing produces nitric oxide much more than mouth breathing does. When we're breathing through our mouths, we are like setting ourselves up to take in a lot more things that can cause inflammation because we're not filtering it properly. So if you can't breathe through your nose because you're sick, don't worry about it. If you can't breathe through your nose because of a structural issue, you might want to go to an ear, nose, and throat doctor and talk about if it's possible to change that structural issue, because it can make a massive difference. Sometimes people have a huge amount of anxiety, and it's literally because they've been mouth breathing for a long time. And there's a lot of other health issues that can be associated with mouth breathing. So if you do have, a structural issue in the nose, see if you might be eligible for surgery, because a lot of people are, and that might be something to explore. And then belly breathing. A lot of us breathe from the top of our lungs. And if you're having chronic headaches or chronic tension in the neck, it might be because you're not breathing properly. You're not using your diaphragm to breathe. So training your body to breathe from the belly, and often this is best done laying down, because when we're sitting up or standing, our diaphragm is working against gravity. But when we're laying down, it's not working against gravity anymore. So lay down and see, when you take a breath, where does it go? Does your belly move in and out? If your belly isn't moving on your in and out breath, something's not going right. So you want to make sure with every inhale, your belly is expanding like a balloon, and on the exhale, it's receding back. If that's not happening, that means you're probably using your accessory muscles in your neck to pull your lungs up. And if you do that all day, every day, it's going to cause neck problems. So focusing on this can help to make you feel better in a lot of ways, but also this will also help to reduce that inflammation. Some other options. Acupuncture can be known to reduce inflammation, yoga and meditation. There's lots of meditation apps out there. There's lots of really great instructional videos on YouTube. Managing your blood sugar, especially if you have diabetes, or if you might be questioning if you have diabetes, that's something to talk about with your doctor. Neurofeedback is another way that we can sort of regulate the limbic system from the actual point of the limbic system. So we can put this device on your head that measures your brain waves and then feeds back to you in real time whether you're regulated or not, and then helps your brain to learn how to regulate. So if you want to do that, you can reach out through smpc.tech. And then how to contact me. So I currently have a wait list for clients. So if you wanted to be added to the wait list, you're welcome to reach out at my email. You can also follow me on TikTok or Instagram there's lots and lots of tips on there already about all the wonderful brain things and mental health things. I'm going to be offering, so I offered a course for Dr. Arsenault in October, but it's full now, unfortunately. So I am going to be looking at what's possible for everyone who wasn't able to get into the course. I'm going to look at that next week, and I will send out an email with a couple other courses I think that I'm going to do in the fall and in the winter, so you can register for those probably next week. And I'm probably going to offer a couple of courses related to mental health and the nervous system and maybe chronic pain. And then I'm also going to offer clinical hypnosis as a group, so you'll be able to sign up for that. And laughter yoga, which is something we haven't really talked a lot about, but I will explain it in the email. So just look out for that email. And if you want to be added to my wait list, then you can reach out via my email there. So let's get into questions. And we have half an hour for these questions, so I'm going to do as many as I can. And there will be a full Q&A session, like an hour and a half of me answering questions sometime in the end of September or October. So if your question doesn't get answered, hold on to it and we can answer it in that Q&A session. How close are we to being able to measure neuroinflammation in ME/CFS patients specifically? I don't know how close we are. I think this new research is all pretty new, and research moves super slowly, unfortunately.
We can do that already, just it's all done in research. So for instance, the study for low-dose naltrexone showed that neuroinflammatory molecules are decreased by 20% on average. The thing that's important is there's like 20 or 25 different things that were tested. And so currently it would be super expensive because I think some of these tests are available privately, but I wouldn't recommend against, I would recommend against getting them done because they're not standardized and we don't know what to do with the results.
Mm-hmm. Someone said glial as in glymphatic. Glial isn't short for anything. That's just the name of the cell. Glial means glue in Latin, and it's just kind of like the glue that holds the brain together. So we've talked about blood work. Can heat exhaustion cause gut issues? I do not know the answer to that question. I'm not sure. That'd be something interesting to look into.
Yeah, we can.
I can. Okay, yeah. Can you train the brain to not respond to mold while living in an environment with molds? No. So mold, especially black mold, is neurotoxic. So it is toxic to our nervous systems, similar to like a, maybe like a bacteria or a virus or something. Mold is just, it's going to interact with your nervous system in a negative way. It needs to be completely removed, or unfortunately, sometimes people have to move if it's not possible to remove it. It's a big problem. And it's not easy to deal with, but yeah, it doesn't look good when people have toxic mold exposure. Can the cause of neuroinflammation be a combination of the items listed on the slide? Yeah, 100%. You could have a lot of childhood trauma, and you could have COVID, and then boom, you have a lot of neuroinflammation that gets turned on. I see that quite often where it's like somebody had a lot of trauma and then there's like one kind of event or virus or something or concussion that stimulates it. And then all of a sudden it's all turned on in the system, right? So it's kind of like sometimes the concussion or the COVID or whatever is the thing that sort of turns everything on from the childhood trauma. And then we have more to deal with. Will neuroinflammation be detectable on an MRI? I don't believe so. Maybe Dr. Arsenault can speak more to that.
Nope.
Yeah, I think because it's so small, the glial cells are like microscopic. The same thing with why we can't detect a concussion, because it's neural, it's like the connections between our neural cells. It's really hard to see it. It's too small. Would headaches also be symptoms of inflammation? Sometimes, yeah, that can definitely be part of it. So yeah, again, there isn't really a test except for in the research scenarios, like Dr. Arsenault was saying, but you can know if you have it based on symptoms, right? It's sort of something that's going to be like if you have chronic fatigue or fibromyalgia or post-concussion syndrome, there's a high likelihood that you probably also have this inflammation as part of the picture. So it's really symptoms-based, like diagnosing all those disorders as well. So hyperbaric oxygen and ozone therapies, I haven't looked into personally. I have had some clients who've done them and had good success, but I've not read the research behind it, so I'm not sure. So yeah, how do you get to see a neurospecialist who's aware of the latest brain science related to inflammation? When your GP isn't listening to you, it's hard. I find like internal medicine specialists tend to have a bit more of this bigger picture. If you're on this lecture, then you're already, on the wait list for Dr. Arsenault, and obviously he's a great doctor who knows about this kind of stuff. So hopefully you'll be seeing him soon. So a lot of these are about blood tests and about tests. So we've talked about that already. Were the other presentations recorded? Yep, they are, and they're on Dr. Arsenault's YouTube channel. So you said that this question says that they've heard as neuroinflammation referred to as brain damage. Is that an accurate description? Can neuroinflammation cause permanent damage? So yeah, it's hard to say if it's brain damage. So what happens, I didn't really go into the actual sort of science behind it because it's very, very sciencey. But what happens is that the glial cells change from one type to another. There's an M1 and an M2 type, and they change into a less active type, and they lose some of their, so a glial cell kind of looks like an octopus with a whole bunch of legs, way more than 8, but they lose some of their legs, so they can't walk around as much. That can't be undone, but the glial cell can be supported to do the job that it needs to do better. So yeah, there is some aspect of the damage that can't be undone, but the function can still come back. It might not be 100%, but it can come back a lot more than the current functioning is if we support the brain properly. So like, is it permanent? Yes and no. Like we can still get a lot of functioning back from it. So does the inflammation go from the gut to the vagus nerve to the brain? So yeah, it's both pathways. So brain to gut, gut to brain. And if you have systemic inflammation, so like inflammation in your joints and stuff like that, then it's all sort of circulating within the blood, and that can go up to the brain. It can impact things in that way. Yes, you will receive a copy of the slides. So there's a question about high histamine foods. That's another thing I haven't heard about, looked into. So do we need, I think this person is asking, like, do you need the different types of fiber in one meal a day or two? So you want to have like as much different fiber as you can. So I guess something that I didn't mention earlier that may be important to mention is that with your fiber, if you're having, your cereal or your oatmeal that's loaded with a bunch of different sources of fiber, you don't want to have that same cereal every single day. Again, you want to switch it up, right? So every meal you want to have 5, 6 different fiber sources, more if you can. It's hard, it's challenging to do, but you can get a little creative with it. And especially if you have a garden, if you have a garden, you can, even a windowsill garden, and you grow like 6 different herbs, that's a really great way to do it in a financially feasible way. Any high fiber granola bars? So we don't want to think about high fiber processed foods like you'll see like labeled on cereal like high fiber. We want to think about different kinds of fiber. So a variety of fiber is more important than thinking about high fiber, and especially in things like granola bars and cereals and bread and stuff that says high fiber, those are going to be very processed. And that comes with its own like usually there's added sugar or there's added just like lots of other ingredients and fillers and stuff that are added in there, and then often high omega-6s. So yeah, I wouldn't look for things that say high fiber. a 1 cup per hour or 10 cups of water for the first 10 hours. Don't drink 10 cups of water an hour, please. that is not going to be good. No, 1 cup and 1 cup for the first 10 hours. So 10 cups of water a day. One thing I want to mention, I'm not sure if anyone has asked this question, but I do think it's really important to mention because I don't want you to do this. A question that I get when I talk about this on TikTok is, well, maybe I should just start taking non-steroidal anti-inflammatories like Tylenol or Advil. Please don't do that. You talk to your doctor. If you need to take Tylenol or Advil, that's totally fine. But taking it frequently, taking it every day has a whole bunch of adverse. So it is an anti-inflammatory, but it has a whole bunch of adverse side effects. It's really bad for your liver. It can cause headaches. And it's just generally not recommended. So please don't take Advil or Tylenol to treat inflammation. That's not a good solution to this, unless, of course, you need to take it for a heart condition or something. But that's, between you and your doctor. So yeah, this person says, I'm enjoying your presentation. Can you tell me if you consulted with a registered dietitian, used evidence-based information? I didn't talk to a registered dietitian, but I did look at the evidence and use the evidence to base that information off of. But I didn't consult with a dietitian about it, which is why I gave the caveat that, this is a little bit out of my wheelhouse, and definitely consult with a dietitian before you make your diet changes, or your doctor. My thoughts on MCT oil. So there's conflicting research about coconut oil. It's hard to sift through it, if I'm being honest. Some people say it's really healthy and like the healthiest thing for you, and some people say it's not. I'd say listen to your body. Your body will tell you what it likes and what it doesn't. And if you add an MCT oil in, which is, I think, like concentrated coconut oil, then you feel great, then great, keep using it. And if you don't. I think listening to our bodies is going to be way more beneficial sometimes than trying to sift through a bunch of conflicting research. Yeah, so this person says, check with your doctor before implementing diet advice. And yeah, definitely. I hopefully made that clear in the presentation, that before you implement, like what I said in the very beginning, was like before you talk about diet or supplements or like a lot of these changes, that you talk to your doctor. And the reason why I say listen to your body and things like that so many times is because I'm sensitive to the fact that a lot of people have eating disorders. And I think it's important to also not just completely limit yourself. Just taking a food group away can be really hard, which is why I was saying with milk and wheat, that's a pretty extreme thing to do. And you might want to do it under the supervision of a healthcare practitioner. So this person says that there's a lot of evidence suggesting that being in ketosis can lower inflammation. Yeah, definitely for some people, ketosis works really well. And there is some interesting research behind ketosis. There's also really interesting research behind being vegan, and they're opposite diets, right? This is why I didn't become a dietitian, and this is why I'm an OT, because there's so many conflicting ideas about what's good for you and what's not good for you. So it's going to be really individual to your body. Some people respond so well to ketosis, and or keto diet, and that's really what works for them. And then some people need a plant-based diet, like being vegan and higher carb, right? So listen to your body again. Is lactose-free milk less inflammatory? Lactose is definitely one of the inflammatory properties in milk. And that's one of the things that our body sort of reacts to in that inflammatory way. So it's probably less inflammatory. I think milk still has a lot of inflammatory properties, just because of like the chemicals that are given to cows and things like that. So, I mean, I've never looked into if lactose-free milk is less inflammatory. I'm just speculating. But I would assume that it's slightly less, but not as not less inflammatory than just like a non-dairy alternative. Yeah, so this person was just reiterating that canola oil is highly inflammatory, which is true. Is yogurt okay and cheese? If you're trying to cut milk out, then you would want to cut out any dairy. So cheese and yogurt, you would want to cut those out for a time and just see how you feel. Again, it's pretty extreme to cut out dairy or wheat. So if you're doing that, probably do it under the supervision of you know, a healthcare practitioner. So this person says that they use unsweetened organic soy milk in their black tea and coffee. Does this count as processed food? I mean, it is processed. It's probably less processed than a lot of food. So I would just say, like, kind of ask yourself, how far away is this from the actual plant? But yeah, I think that's probably fine. It's hard for me, again, to answer like specific diet questions, just because I'm not a registered dietitian and I want to stay in my lane, but just the general recommendations I've made, and then you can kind of go further with it with exploration with your healthcare team. So someone asked why no intermittent fasting. So the research that I read about this was specifically talking about just like the spikes in blood sugar, and like, you know, not like fasting for a while and then you have a high carb meal, you're basically like highly spiking your blood sugar. And like we talked about, the blood sugar fluctuations can cause more inflammation. So if you're intermittent fasting and then you have a high fat meal, like with ketosis, or you're actually in ketosis, so you're not introducing all the carbs and sugar, then it's less of a roller coaster for your blood sugar. So that's sort of the reasoning behind that. So someone asked about monk fruit sugar. That I didn't mention that, but yeah, that's another good alternative for sure. Honey or maple syrup as sweetener. So those are still going to break down to sugar. Honey has, like, raw unpasteurized honey has some great properties to it. But I would just limit it, right? Again, we don't want to like fully, unless you're really trying to see what affects you and what doesn't, we don't really want to like fully limit ourselves. We still have to live our lives. And so much of socializing and enjoying life involves enjoying food. So I would try not to be too strict about this. But yeah, just kind of limiting things, unless of course you're like really trying to figure out what it is that causes you more symptoms. Stevia. Yeah, stevia is better. It can still mess with blood sugar levels. Anytime you give yourself something that's like a fake sugar and then your body doesn't get that sugar, it's messing with blood sugar levels a little bit, but it's not as bad as having like sugar or aspartame, as far as I know from my own personal knowledge. Some people are saying that xylitol triggers IBS, so I guess watch out for that. Someone was saying, is it beneficial to lower gluten intake even if I've been tested for a gluten intolerance and celiac? So yeah, again, there's lots of conflicting evidence about this. Some people think it's not the gluten itself. Some people think it's like how the gluten is processed and some of the chemicals that are used with growing wheat that people are sensitive to. So that could be a reason to try not having it for a while. And another thing is that some people believe that you can have sensitivity without intolerance. So like you can have a sensitivity without celiac, and some people think that that's not true at all. So I would go with what you think and kind of your own intuition, and you can experiment with it. And it's, you know, not the end of the world to try experimenting with it for a little while. And if it doesn't work, it doesn't work. But at least you're trying things, you know. A sugar-free gum. Yeah, there's a gum called Pure, or yeah, PUR. Oh, you don't care for that one. I didn't read that part of it. That's the only one I know. I'm sorry. So I explained why on a keto diet it's okay to fast. Are some kind of alcohol better or worse than others? Well, I mean, some people say that, drinking a glass of wine can be helpful because of the polyphenols in the grapes. Resveratrol is made from grapes, so maybe having a glass of wine once a week wouldn't be the worst thing in the world, but it's still alcohol, so it's still a nervous system depressant, and yeah, ultimately, I don't know. You want to enjoy life. If having a glass of wine is you really like to do that, then by all means. But yeah, just kind of consider the risks and the benefits. So someone says, if you're high in mercury toxicity from eating too much salmon and fish, what other omega-3 supplement would you recommend? So they do have vegan ones, and I'm pretty sure they're made with kelp. I'm not sure if kelp has mercury in it because it's also in the ocean. Maybe it's absorbing, but maybe it doesn't absorb it. I would look into if the kelp vegan omega-3 supplements have mercury in them. Just kind of take a look. Let's see. So yeah, someone was asking about sparkling coconut water and like the sugars in coconut water. I mean, yeah, if you look at the can, sometimes it's like 28 to 32 grams of sugar, which is a lot of sugar. So again, just kind of limiting the amount of sugar intake in general, even if it's a fruit sugar. The difference between eating a fruit and drinking a fruit is that when you're eating it, you have the fiber from the fruit to help you digest properly and like to mitigate some of the sugar intake. When you're drinking it, unless it's like a smoothie where the fiber from the fruit is actually still in there. If you're just drinking fruit juices or coconut water or something like that, you're just like, it's just a straight shot of sugar. So that can really increase your blood sugar. So let's see. Okay, so someone started drinking salt for their pots, but they've been adding Ribena. I don't know what that is. Sugar, 36 grams per glass. It's a lot of sugar. And if you're taking that every day, that's like pounds of sugar per year. So yeah, I would definitely consider if you can maybe put lemon in the water instead or something to change the taste of it. Yeah, I'm not sure how to get around that, but I'm sure that you can kind of get creative with it and think about other things to change the flavor. Okay. So I'm not sure if it's a probiotic that increases. So someone says, which probiotic is it that can increase inflammation? I'm not sure if it's increasing inflammation. It's just that they're often connected with brain fog. I don't have that exact name off the top of my head, but you can Google like which probiotics cause brain fog the most often. I also think it's pretty personal. Like some people experience it and some people don't, just depending on the gut bacteria that they already have. So I would just experiment with the probiotics. And if you find that you're feeling worse, just know that it might be because of the probiotics. Can you eat cooked prebiotic veggies and still get the benefit? Things are going to be better raw. They retain more of their bacteria raw, but I'm sure there's still some benefit to it being cooked. Let's see. Yeah, so there's the MCAS. So there's a couple of questions on here about like the high histamine fermented foods are on the no list for MCAS. So yeah, you're kind of just going to have to play around with that and see what foods are, matching of both diets. Sometimes two different diets just don't match up, right? And they have some things that don't overlap. So this person is just asking about, is there a way, since COVID, they've had concentration difficulties, and they're wondering if there's a way to restore the ability to concentrate without triggering neuroinflammation. So by using some of these things that we talked about, so the nervous system regulation stuff, the sleep hygiene, the diet, the exercise, those things are likely to help reduce that inflammation, and that can help the concentration. We're also going to talk next week about neuroplasticity. So we're going to talk about how when we repeat things over and over, we can kind of change the brain and build those things back up. So you might want to check out that lecture too. So questions about, like this question sort of like, would resveratrol be bad if I have low blood pressure? I would recommend talking to a pharmacist or doctor about that, just so that I kind of stay in my lane a little bit more. Okay, yeah, a lot of people are saying that some of the things that were suggested are contraindicated with IBS or MCAS. So yeah, just tailor your diet to your specific needs. What is NAC and BBB? So NAC is N-acetylcysteine, I think, and BBB is the blood-brain barrier. In terms of the amounts for curcumin, I would talk to a pharmacist about that, or maybe a naturopath. Yeah, a lot of people are asking questions about dosages or interactions with other medications or things like that. Yeah, just chat with your doctor or pharmacist about those kinds of questions. Or a naturopath could be a good option as well. It's about 6 more minutes. I'm going to answer as many of these as I can. So this person was saying dairy products that have a good protein profile, substitute for dairy products. So yeah, things that are, you're saying that you don't like tofu products, soy products in terms of like soy cheeses and stuff. I'm not sure if that includes what you don't like, but there's also a lot of nut-based things have higher protein. It is, yeah, definitely on a a vegan diet, it's hard to get protein, and you just have to be creative with it. Can you continue to use THC if balanced with CBD? So from my understanding of the way that they interact with each other is that they're competitive. So if you have enough CBD, it competes with the THC, so the THC has less of an effect. So that could be part of it. You could like use the THC still if there was enough CBD, but they're going to be competing anyways. So you wouldn't get as much THC. That's my like basic understanding from many years ago of looking into it. So I'm not sure if that's still updated in the research. The info sheet for LDN is found, just like Google LDN info sheet and PDF, and it will pop up. What is a good simple movement you recommend if you've been bedbound and even walking and standing is exhausting? So there's really gentle guided movement videos. You can look up movement for chronic fatigue on YouTube. Feldenkrais, Feldenkrais, Feldenkrais is a really good slow movement. Tai Chi, those kinds of things. You can even just kind of work within your own body and notice, how your body wants to move and do some gentle stretching that way. So someone said of the remedies I've suggested today, what I recommend most for traumatic brain injury or concussion. All of them. It sounds silly, but definitely we need to focus on all of them if we want to get better. Traumatic brain injury, there's a couple other things to consider as well. And if there's enough need for it, I could also do another presentation on concussions and recovering from post-concussion syndrome. But yeah, we have to do all the things. Unfortunately, there isn't one that's going to be the panacea for all of it. So this person asked about the misuse of vagal stimulation machines and could potentially lead to cardiac arrhythmias. Yeah, the vagus nervus is connected to the heart. So the reason I didn't include vagal stimulation machines on here, I just include like organic ways to do it, is because that needs to be guided very specifically by a doctor. You don't want to just mess around with doing that on your own. So yeah, I would chat with a doctor about vagal stimulation devices if that's something you're interested in. Does melatonin help to clear up inflammation and toxins? I've never really heard about melatonin in terms of inflammation. I have heard of melatonin in terms of it can mess with your hormones. From my understanding, melatonin isn't really recommended even as like a sleep aid. It can cause nightmares and also can mess with your hormones a lot. There's a lot of other great options for sleep aids. But yeah, from Dr. Huberman, who's an amazing scientist that I really enjoy listening to on his podcast, he talks a lot about melatonin and how it can mess with your hormones. So he recommends not taking it. So this person was asking like how much in advance before sleep do you have to exercise? They say that they exercise 3 hours before bed. That's probably enough space. I mean, ideally you would have a little bit more time, maybe 4 or 5 hours before bed, just to get your body to settle. Exercising in the morning is probably best for most people, but because it sets up your day. But yeah, probably 4 or 5 hours before bed is good. Again, it's going to be quite individual. How long after waking to be in the sunshine or outside? 15 to 20 minutes. Are light boxes a reasonable substitute for natural light in the mornings? No, they're not going to be as good. There's like, I think 10,000 lux in a light box, and there's many, many more from the sun. So yeah, definitely getting outside and getting that direct sun exposure, even if it's a cloudy day, is going to be better than a light box. Though if it's the middle of winter and it's super dark, and you're getting up, way before sunrise, then yeah, it can be helpful to have those. With the physiological sigh, yes, you breathe out through the mouth. And if you look up physiological sigh on YouTube, there are demonstrations of how to do it. Okay, so it's 4:30. So I have to stop there. I'm sorry I didn't get to everyone's questions. There will be a Q&A, so just take a look in the emails for that. or Bruno will send out the information for that. And like I said, I do have a wait list right now. If you want to be put on it, you can email me. And if not, then just stay tuned. I'm doing really affordable group classes in the fall and the winter. So I will send those out via email probably next week.
Perfect. And September 25th, 1 p.m. is your Q&A session.
Perfect.
Okay. Have a great week, everybody. And thank you so much, Zara. I learn every time you speak. Take care, everybody.
Alrighty. Take care. Have an awesome weekend, everybody.